Scoliosis is a spine deformity. A deformity is an abnormal structure. When you look at a spine from the front, it appears straight. From the side, there is a slight hump in the upper back and a curve in the lower back. These are normal features in everyone. Scoliosis means a bending in an S shape when viewed from the front. It tilts slightly to the right or left in the plane. When viewed from the side, these structures can also change in terms of kyphosis and lordosis. Scoliosis is when we look from the front and see the spine tilted right or left. Then there's kyphosis. What we call kyphosis is an increase in the normal 40-degree curvature when viewed from the side. This is seen in certain other specific diseases. Kyphosis and scoliosis can also indeed be present in a child from birth. We actually call these congenital. So if a person has these deformities at birth, they are congenital. There could be various reasons for this. There's no need to go into detail. It could be a bone anomaly, a spinal cord anomaly, a syndrome, etc. We are talking about someone who has reached adolescence and adulthood and presents with a spinal deformity, scoliosis or kyphosis. Scoliosis is generally what we typically call adolescent idiopathic, meaning it usually occurs around the ages of 8 to 10 without any known cause. But we now accept it as genetic and have identified many related genes. The treatments for this in childhood include exercises such as stretching, braces, and some minimal surgical procedures. As you get older, if it goes beyond a certain degree and you can't control it, specifically if it exceeds 45 degrees, it's a condition we treat with surgery. Kyphosis is a bit different. Kyphosis is when the patient bends forward when viewed from the side. This is the condition of kyphosis. There are many reasons. In younger people, there is a type of kyphosis called Scheuermann's. There are a number of rheumatic diseases that we call Ankylosing spondylitis. This Ankylosing spondylitis is a well-known condition. This is a condition that gradually and slightly bends the spine forward into this position when viewed from the side in a single plane. When you look from the front, it seems straight, but when you look from the side, you see it is bent. It's a condition like this. Your spine bends from your neck base to your pelvic bone, but your movement is also restricted. Think of it this way. Think of it like a candle or a young person slowly bending. You can correct it with exercise. But in the later stages of ankylosing spondylitis, the spine becomes like a bamboo cane. In other words, it becomes completely immobile. The patient can't lift their head, can't see ahead, and can't lie down in bed. Because in this position, they are stuck rigid like a pipe. If you can correct this patient, if it is early stage ankylosing spondylitis, they are treated in the rheumatology department, they do exercises and use some medications. But when the patient comes to you at a later stage, bent forward, unresponsive to medication, with joints worsening, and the hip joint is also involved, this patient will not be able to move at all. Imagine this patient, you need to tilt your head back like this to drink water. This patient can't even drink water. It is a condition that greatly reduces quality of life, which we refer to as high morbidity. If you can correct this, you are adding something very significant to the patient's life. Indeed, we will see our patient very shortly. When we examine our patient, we will see that despite being bent forward, they are still able to walk. But in this patient, the hips have started to be affected, with the right hip beginning to show symptoms. This patient has been using anti-rheumatic drugs for a considerable amount of time, but unfortunately they are also gradually developing tolerance to them. This is the biggest problem. It's an autoimmune rheumatic disease. Because it's autoimmune, the medications lose their effectiveness. You move on to the next level of medication, but it doesn't work. After a while, it stops being effective. You end up stuck in this vicious cycle, and inevitably, you have to perform surgery to correct the deformity. What is scoliosis? Let's take a look. When we look at the patient from the front, they appear perfectly straight. Scoliosis means this alignment is disrupted. When you look from the front, it means tilting slightly to the right or left. This also means it comes to this position while tilting a bit. When you look from the front, this is how scoliosis looks. It twists within itself like this. This is scoliosis. As we mentioned, it can be congenital, present from birth, can appear later due to certain syndromes, or it can be idiopathic. Due to a number of genetic disorders, gene-related, mutation-related, we are looking from the side. This is a normal spine. When viewed from the side, there is a hump in the back and a dip in the lower back. We call this lordosis. If this hump, which is known as kyphosis, increases in size, as you can see here, we also refer to this condition as kyphosis. When you look at this kyphosis from the front, it actually looks really completely straight. In fact, when viewed from the side, we see an increased curvature. This is called kyphosis, not scoliosis. This is kyphosis. It can occur in certain rheumatic diseases, in specific types of kyphosis, like what we call Scheuermann's kyphosis, or in postural types that do not require any treatment. Such rigidity can indeed occur in Scheuermann's kyphosis or ankylosing spondylitis, and our patient has ankylosing spondylitis. Our patient is roughly in this condition. We plan to correct the patient. It's a major surgery with osteotomy. You were using a pillow. How many pillows did you reduce to after the surgery?
I was actually using 2 pillows. Now I'm currently down to 1.
Super. Very nice. Wonderful. Hopefully after this surgery you'll be able to sleep even more comfortably with 1 pillow. Come on, Alperen, let's examine you right now. Let's check one last thing before the surgery. Do you have trouble seeing ahead while walking? Have you ever hit your head on something like that?
I had actually bumped into it before having surgery.
Before the surgery, you used to bump your head, right? Can you take off your shirt? You are using something, aren't you? You are taking medication for ankylosing spondylitis. What are you using?
I am currently using Exergens.
Yes, beautiful. Do you have hip pain?
Yes, there is.
Is it your right hip more? The right hip has started to get affected. When you take your medication, take off your ankylosing spondylitis brace too. Do your pains ease a bit?
Yes, it's getting lighter.
It's getting lighter. All right. Good. Now, neck movements, aren't the neck movements very slow? Yes, slowly and carefully. Can you please stand up like this? Now turn around like this and turn to the side like this. Looking here, the lower back is not bad. It's improved well. But we have something here. We have a hump. We'll fix this part and move this one back like this. We'll move it back slightly. Now, after the surgery, you'll be able to look straight ahead instead of down. Can you move your neck forward and backward like this a bit? Zero movement. Can you turn to the right or left at all? You can't, right? So you can't bend forward or backward at all either. So how do you drink water? Can you drink water comfortably at all?
A little bit.
You're struggling, aren't you? Are you having trouble swallowing solid foods?
No.
You're not straining. Understood. Okay, good. Now, can you bend forward? We can bend forward. We bend from the hips. There's no movement here. Let's try going backward. There's no movement backward. This has become completely rigid. The only way to correct this will be to take it back with an osteotomy here. Come here, lie down. Let's check our hips. Our hips are important because they are ours. Let's take off our shoes, because in ankylosing spondylitis, the hips are also affected. Come, please lie down. I remember your right hip was affected. Yes. How many years have you been dealing with ankylosing spondylitis? How long have you been dealing with this? Now, if we look here, our left hip is perfectly fine. The child?
From COVID.
It's been 4 years since COVID?
Yes.
Look, this hip is starting to open to the side. There's no movement here. The right hip is stuck. The right hip doesn't fully open, but the left hip is very flexible. Now he is still having trouble placing his head down, but after the surgery, he will be able to completely lay his head on the bed. Move your head forward and backward again. Backward. Yes, that's it.
The patient with ankylosing spondylitis had surgery before.
But the patient cannot walk straight from the curvature at the top, the hump. We will perform the second planned osteotomy today.
We will remove a wedge of approximately 40-45 degrees from the level where the screws are located above, allowing the patient to stand more upright and walk.
Today is the third day of our surgery. We will get Alperin on his feet. Alperin, how are you feeling?
I feel good.
You're feeling good, you're great. Let's get you on your feet. See if we can see across. You help too. Slowly, take it slow. From the back, let's help. Slowly, slowly, slowly. Yasemin, I might need your help. Come, this way. Yasemin, if you come over here, it might be better on this side. Good job. Okay, come here. We are slowly bringing our feet here. We are putting on our slippers. Let's put on your slippers. Is your head spinning? Super. Did we do our morning run? We did.
All right.
All right, now 1, 2, 3. Super, you're amazing, you're amazing. Did you grow taller? It seems like you grew a bit. Okay, look straight ahead now. Because of ankylosing spondylitis, there's something with your right hip, a flexion contracture. As it loosens, you'll feel a bit more comfortable. Let's go, look straight ahead and walk slowly. Super, very good. Is there any pain in your right hip? No, not much. Super, great. That's it. We corrected the kyphotic area, the humpbacked area, with an osteotomy procedure. Now let's turn back. Let's not tire you out for the first time.